So if all the men start living till the age of 100, 110, like that age, then almost everybody will have symptoms. 1 out of 8 men are known to have prostate cancer. As doctors, as humans, we need to understand that every individual is different. The patient has to be compliant. Now, I can't give this treatment option to a person who is not willing to come.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Hello dear friends, good evening. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle, a talk show with the expert doctors of Al Hilal hospitals and medical centers. Today we'll be discussing about an important aspect of men's health, the prostate. The prostate is a small gland found only in males, but they become aware of it only when something goes wrong. Today we'll be discussing about the prostate health, the risk factors, screening options and the treatment with Dr. ARUN Antony, the consultant urologist from Al Hilal Premier Hospital, Segaya. Doctor, welcome to the show.
Thank you. It's been my pleasure.
So, Doctor, can you explain prostate for us in detail, and also why is it important in men's health?
Yeah, just like you have explained, you have said it very correctly that prostate is seen only in the males. So, this is an organ which is found at the junction of bladder, neck and urethra. Now, urethra is the tube through which urine passes. So, this is an accessory sexual organ which helps in certain sexual functions in the men. But one peculiar feature of this organ is that it keeps growing till death. So, like I told you, it is located at the junction of the bladder, neck and urethra, which is the tube through which urine passes. Now, because this keeps growing till death, with age, as it grows, it causes a compression on the urethra, which leads to urinary symptoms. So that is why the symptoms appear much later. So the bottom line is it serves two purposes. One is sexual, second is urinary. And it is the size of it's a very small size in a newborn child, and then it keeps growing till death and average size is approximately 18 to 24 grams. So this is what in short is prostate.
And doctor, around what age should men pay attention to their prostate health?
So generally prostate is something that starts affecting men in the age group of 50s. So that's the initial point of symptoms. But most of the men will have symptoms in the 60s. The thing is, like I mentioned, that the prostate will keep growing till death. So if all the men start living till the age of 100, 110, like that age, then almost everybody will have symptoms. But most of the times we don't live that long. So 50s is the initial point for a lot of patients, but majority of the prostate patients will develop symptoms in the 60s. And then as the age increases, the percentage of men getting involved with the symptoms also keeps going up.
Now doctor, can you explain about the early signs and symptoms of prostate problems?
Yeah, so like I mentioned, the prostate, when it keeps growing, it causes a compression on the urethra. So this causes a difficulty for the male in urination. So the symptoms generally includes when a male goes to the washroom, he has to strain a lot to pass urine. Sometimes he is standing there or sitting there, but it takes a lot of time for the urination to start. There could be a sense of incomplete emptying of the bladder. Sometimes because of this incomplete emptying, he gets up again and again at night to pass urine. There can be symptoms like urgency, where he needs to rush to the washroom to pass urine. There could be burning sensation while passing urine. Sometimes the prostate can start misbehaving, and then bleeding can also happen from the prostate. In such cases, the patient might notice blood in urine. So these are some of the common symptoms that you see in a patient who has prostate enlargement.
Okay. Now coming to the prostate cancer, how common is prostate cancer and who are at risk of this?
So prostate cancer is a very common cancer in men. It is one of the most common cancers rather. 1 out of 8 men are known to have prostate cancer. The most common subset of patients who develop this is Afro-American genetics. So patients who are of African descent, they are more prone to this. Another subset of risk would be those who already have a family history of prostate cancer. So if it runs in your family, it's more likely that you can also have prostate cancer. Then of course, most of the times it happens after the age of 65. So with age, you need to start screening for prostate cancer.
And doctor, you already mentioned about some of the symptoms. What are the early signs the men should not ignore?
Yeah, see, the prostate cancer, like what we are talking today, is the symptoms that we talked are about the prostate enlargement. Now this enlargement can be age related, like I told you, or it can even be due to prostate cancer. The initial symptoms, there cannot be any differentiation. They are very same. So it's the same thing. Straining, intermittent urinary stream, sense of incomplete emptying of the bladder, getting up at night. So initially, it's impossible to differentiate a prostate cancer from an age-related growth just based on symptoms. So you do the distinguishing based on rectal examination of the patient and a blood test known as PSA. But yes, if we talk about an aggressive cancer, a late stage prostate cancer, then prostate cancer has a tendency to spread to the bones. Now because it spread to the bones, the patient can have back pain, the patient can have pain in the pelvis. So these are some of the symptoms that can happen.
And doctor, can you speak about the importance of early detection of prostate cancer and also what are the screening tests available?
Yeah, so early detection is crucial in any cancer for that matter. So prostate cancer technically has got 4 stages, but for making it easy for the audience, I am going to classify it into 3. So stage 1 is prostate cancer, which is localized. That means it is just located in the prostate. Stage 2 is locally advanced. That means it has gone to the adjacent organs. And stage 3 is metastatic. That means it has spread to different parts of the body, like liver, bone, those sort of things. So when you start screening, the advantage is you can catch the prostate cancer earlier. So it is easier to treat the patient if it is localized, that is just in the prostate, and the patient has a better prognosis. Patient has a better scope of survival, better future. So by all means, screening is cardinal and it helps in prevention, early detection and spreading awareness as well. And the best way to screen it is a simple blood test known as PSA. It's nothing complex, just one blood test. Do it if you are in your 50s, and with that PSA report, go and consult your urologist. The urologist can guide you when to do the next test and whether it is significant, not significant. whether to act upon it at present or not, and how to follow it up.
Now coming to the treatment, how has treatment evolved over the years of prostate cancer?
So treatment has evolved over the years in a lot of ways, in the sense that now we have got robotic surgery. If we are talking about prostate cancer, radiation treatment has become more focused. We have latest chemotherapeutic drugs. The hormonal agents have changed. Initially, Charles Huggins was the first urologist actually who was attributed or given the Nobel Prize in medicine for this thing, and what he had advised was castration. Castration is removal of testis. Okay, so that was a surgical castration which was happening decades back. Now we have moved to a decade where, or an era where we are having medical castration. We are having so many hormonal agents, so many new treatment agents. So this is all a paradigm shift in the evolution of treatment of prostate cancer.
And are there any lifestyle factors that can reduce the prostate problems? Can you speak about the lifestyle factors like exercise and diet?
Yeah, so this is one topic which gets talked about a lot, but to be honest, there is no concrete data that these things can prevent prostate cancer as such. Generally, like I told, there are certain irritative symptoms of enlarged prostate. Now, whether that enlargement is age related or prostate cancer, it's a separate thing. But it can have irritative symptoms which include urgency, dysuria, sometimes urinary incontinence. All these symptoms are better handled in a person who is fit, who takes his balanced diet regularly, who does not smoke, who maintains his weight. So this way, yes, it helps. But there is no evidence to suggest that by doing exercise, by avoiding smoking, you will be preventing prostate cancer as such. So those data are anecdotal. There is no scientific evidence for that.
Doctor, how does our stress levels affect the prostate health? Is there any connection between stress and prostate health?
So technically, stress can increase your irritative symptoms like sense of urgency, sense of getting up from sleep at night. So stress can increase that. Of course, there is always a correlation between stress and sleep and prostate. So stress increases these symptoms, and prostate further disturbs your sleep. So what happens, because you are not able to empty your bladder completely, like a normal patient, when a normal person rather, when he empties the bladder completely, he goes to sleep peacefully. A patient who has an enlarged prostate will not be able to empty the bladder completely. So he is getting up again and again at night. So he is going to the washroom 4 or 5 times at night. So this way his sleep gets disturbed. Stress increases this way also. So there is a complex correlation. They are not directly correlated in the sense that stress does not create prostatic problems. But if you have a prostatic issue, stress will aggravate it.
Doctor, now coming to the treatment options. What are the treatment options at different stages of prostate cancer?
Yeah, so I will not go into the medical stages of it, but if we talk about the stages like I have described, one is the localized prostate cancer, which is just at the prostate. Second is locally advanced, and third is metastatic. That is, it has spread to different parts of the body. Now, all these have got different types of treatment options. So, for a localized prostate cancer, you can have something known as active surveillance, where basically you are not aggressively treating the disease, but you are giving an option to the patient that he can come for regular follow-ups. You can of course go for removal of the prostate, which is the surgical option. You can go for radiation. Similarly, the locally advanced has a multi-modality treatment, that is, it will have a combination of some of these. And metastatic, where the prostate cancer has spread to different parts, that's more dependent on hormonal treatment.
And if a patient comes to you, how do you decide which treatment is best for him?
Yeah, so every doctor has a different approach to this, because like I said, there are so many options. So I believe in shared decision making. So if any patient has come to me, I prefer to discuss the treatment options that are available at that current stage to that patient. So see, what is the difference between a patient and a doctor? Is that the doctor has the knowledge, patient has no idea. So my whole concept is that I share that knowledge with the patient. Now he also has an idea. So I want my patient, if it is my patient, I want him to be involved in that decision making. So when the patient understands the pros and cons, when the patient is actively involved in decision making, he is more likely to be compliant as well. Now let me give you an example. Let's say we are talking about a localized prostate cancer. Now there are three treatment options: radiation, surgery, active surveillance. Now we need to, as doctors, as humans, we need to understand that every individual is different. So everybody will have some priorities or some ideas about how to go about in their life. Now let's say there is a patient who wants to choose active surveillance. He does not want a surgery, he does not want a radiation. So if he is willing for strict follow-up, he is always going to come when I call him. Like if I tell him you have to come after 2 months, he is willing for everything. He is willing for a stringent follow-up, and if he satisfies all the criteria, even this is a treatment option. But then the patient has to be compliant. Now I can't give this treatment option to a person who is not willing to come. There could be another patient who might say, sir, I don't want all this headache. I don't want to come every 2 months. You settle this once and all for me. Then I will suggest surgery for him. So I prefer the patient to be involved in the decision making.
And doctor, another query from our viewers is, can the prostate cancer be treated without surgery?
Yeah, so yes, it can be treated like I have told you about all these stages. I understand the general apprehension of public about surgery. So of course, all the treatment options I have discussed, but I need to clear some myth about the surgery for prostate. So patients come to me with all sort of ideas that doing a surgery for prostate will lead to this or this. So today I am going to tell you what is the difference between a prostate surgery for age-related prostate growth and a growth which is due to prostate cancer. So imagine it like an apple. Okay. Now in age-related prostate growth, which we call BPH, what we are doing is a core through surgery. So we are creating a core inside the apple. So the outer red layer and an inner white layer of apple is left behind, so that the patient has a good passage to pass urine. Now on the contrary, if the patient has a prostate cancer, we are completely removing that apple and throwing it out of the body. So that's the cardinal difference between surgery. Now when there is such a drastic difference, you need to understand the surgical time, the complications, the post-operative follow-up. All these things are going to be entirely different from both the surgeries. So patients need to understand that saying that prostate surgery will lead to this or this, it's not the right way to go about it. There are different types of surgeries, there are different indications, and there is no need to be afraid of surgery. If you need a surgery, you will get the best options. But yes, there are a lot of treatment options for prostate cancer. That of course is dependent on the stage as well.
Doctor, can you speak about some of the misconceptions related to prostate health?
Yeah, so like the discussion that has been going on today, we are discussing about prostate affecting men in the 50s or above that age. But what we are talking about is age-related prostate growth, which is BPH, and prostate cancer. But there is an entity which can affect young men as well, in the 30s, in the 40s, which is known as prostatitis, which is basically an infection of the prostate. So they can also have a very similar symptom, but the diagnosis is entirely different. So prostate can affect young men as well. And another misconception is men tend to believe that once they are old age, once these problems start, this is age related. So there is nothing to do in this, which is actually a wrong idea. Because what happens is that the urine is produced by the kidneys. So it goes from the kidneys to the prostate. Now because the prostate is it goes to the bladder. And if the prostate is creating a problem in emptying of the bladder, the pressure goes back to the kidneys. So the kidneys can also get damaged. So it is not something like you can relax, okay, because of the age it is happening. Yes, it is happening due to age, but that does not mean that it is expected and you need not address it. So these issues need to be addressed.
And before we wind up, doctor, what is the one key message you want our viewers to keep in mind after this discussion?
Yeah, so two messages if I can give through this platform, it would be great. One of course is that most of the times when we talk about prostate, it seems that it's a male problem, so females don't have to get involved. Yes, medically it's a male problem, but you need to understand men have a slight psychological block to getting treated, because they feel that it emasculates them. They feel that if they seek treatment, they appear weak. So they don't talk about their health problems. So if there is any female at home who notices the male having these issues, like getting up from sleep again and again at night, some difficulty in passing urine, those things the females may not know, but getting up from sleep is something they can easily notice. So then they need to encourage them to seek medical support. So that is the first thing. So females also need to be alert about this. Second thing is, if you have a prostate problem, like the first thing I told in today's show was the prostate will keep growing till death. So this is, I'm talking about age related prostate growth, which is BPH. So if you have a prostate problem and you have been advised medical treatment, you will have to take it for the rest of your life, because the prostate is going to keep growing till your death. So the medicine will also have to be taken till death, unless and until the doctor tells you, okay, the medicine is not working, you may need a surgical option. So if you are behaving well with medicine, then you need to continue it for life. One mistake that patients do is, let's say if a patient has come to me and I have written that, okay, you need to take this medicine for 30 days. After 30 days, you have to come back. What the patient does is that he starts feeling better with the medicine, and then he does not turn up after 30 days because he says, I was doing better. Then he again comes after 3 months, because he is definitely going to come, because the prostate is going to keep growing. So this is one message I want to give, that the doctor gives two advice. The doctor says you take the medicine for 30 days and come back after 30 days. The patient listens to just one advice. He will not come back and he will stop the medicine after 30 days. So maybe medications will be lifelong. You need to understand that. That's an important message.
And finally, doctor, what do you have to say about Al Hilal Healthcare Service? What are the services you offer in your Al Hilal Premier branch?
I have been very new in Bahrain, so I am looking forward to contribute to the field of urology in Bahrain via the channel of Al Hilal Hospitals. So this is something we started in 2005. We are in business for the last 2 decades. Al Hilal Premier is our new full-fledged branch, and it has everything under one roof, whether you talk about urology, nephrology, neurosurgery, bariatric surgery, and anesthesia setup, OT setup. So we have everything under one roof, gastroenterology. So the thing is, if you have any healthcare concern, by coming to this branch, your all the health issues can be addressed under one roof. So that's one advantage of coming to Al Hilal Premier.
Thank you, doctor. Thank you very much for taking time out of your busy schedule and being with us today and giving us a lot of valuable information about prostate. I'm sure our viewers will benefit from this show.
The pleasure was all mine. Thanks a lot.
So viewers, I hope this episode was helpful. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time with a new doctor and a new topic, this is Jasila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.